I want to welcome all of you to Coronavirus Inside the Arizona Numbers, where Garrett and I take a deep dive every single day into the data that's coming into everywhere here in Arizona so we can help walk you through it so you can make the best choices for your life and your family. It's what we do here every single day. We're on a little bit later here today. The county gave out some information earlier, and we'll go over that in a bit. Maybe some of you watched it right here on Facebook Live, but we want to get to all of your questions and comments. So if there's a number that you're looking for, so many people saying hi, hello, thank you for joining us. I'm seeing all these names on here, so thank you for joining us. Let us know if there's something we can help you find as far as these numbers go. Some good news today and some really rough news today. So we'll get through all of it here together. We'll carefully walk you through that. Garrett, I'll let you pick. Did you want to start with the better news, the R naught number, or the summary page, which was some really unfortunate news today?
I think we should probably just start with the summary page because that's where all these numbers originate from anyway. So yeah, I've got the screen shared already. This is the AZDHS summary page, and here this is where you go to the dashboard, and we can look at what today's the last 24 hours were reported. We have 3,257 cases today reported off of about 14,000 tests. That gives us a percent positive rate today of about 24%. It's a little higher than it was the last couple days, but still pretty good. But let's go to the number that sort of stuck out today, this 97 deaths. This was not done with certificate matching. This was just done. This was just reported to from the counties to the Department of Health. So we had that's a very inordinately high number of deaths for just a weekday report when we've already had sort of that high number of deaths. So we've had several very high number of deaths reported in the last several days.
And we want to pause to remember that every single number that we're getting in like that is a family and a loved one behind that number. I was mentioning to Garrett before we started here, I hopped on Facebook for a brief second and saw another friend here in Arizona had just lost his wife to this. So this is the reason that we continue to do this, to help you understand the numbers and be able to make the best choices for your family. So we want to recognize that there's a family hurting behind every single one of those numbers. I'm already seeing so many questions and comments come in, and I want to pause for one. I think it was Ricky just a little bit ago saying that the tests were still hard to get. So I just want to briefly touch on where you can get the tests. The goal right now is to test 60,000 people over the next 12 days. And there's her question. Oh, thank you, Ricky. We love you too. Testing does seem hard to get right now. So let's talk about where you can find it. 60,000 people over the next 12 days is the goal. It's going to be free drive-through testing at 2 locations in Phoenix. One of them's over at South Mountain Park and the other's at Maryville High School. So this is something that you need to sign up for. At last check, the sign-up information wasn't released just yet, but guarantee that we will keep you guys updated on how to get those tests done and that major, massive testing blitz. It's called the Testing Strike Force. That is going to be the place to get a number of these tests pushed through, and also some of the locations that we have talked about before on here. South Mountain Community College, where they have seen some long lines, and some other testing sites that you do need to bring your ID for. So we'll go over even more of those as we talk throughout this hour. But Garrett, any other numbers you want to highlight on this page before we get to a few more questions?
The one other number that we always want to look at is this total PCR percent positive. PCR being defined as the nasal swab test, the diagnostic test that checks to see if you actually have a present active infection. And that number is that was 14.2 yesterday, so it did go up 1/10 of a point. And it had stayed level for about 2 days now. Although we don't want to see that number going up. Realistically, having it only go up by 1/10 of a point at this time is not terrible news. So, you know, it's something that we can at least find a little encouraging on, because the last couple of weeks that number was going up by 3/10, 4/10 of a point every day. So it was very discouraging.
And we can dive into that number a little bit more on another page on here. We want to show folks that we talk about often because it shows the week by week breakdown, so we can see how that number looks. That's up a bit on this same page, right, Garrett?
Yeah, so we can look at the laboratory testing. It's right here in this little button right here. You come to here. And then you can go down here and you can see what the week by week layout of these tests and their percent positive. We're going to focus mainly on this graph right here. This is when the tests are compounded by week. Now I'm just going to make a caveat here. When these reports are given to us, these state reports, 14,000 today, that does not mean 14,000 tests were done today. In fact, you can see this is the actual date of tests, and this certainly is not a number that is anywhere near 14,000. It's actually 38 from yesterday. So that 14,000 actually rolled into all of this week and even some of this week, or the week prior. So what you're looking at here is when the actual date of test collection, and then what those percent positives were. So what we have is we have 20% on the week of June 21st. You can see how that's sort of where it started to peak. June 21st, or excuse me, 21% on June 28th is the peak so far what we have. And right now we're down all the way to 17% on July 5th, which is that's a great number. I mean, like where we were and where that, as you can see what that rise was like, having it go from 21 to 17 right now is good. Now this obviously, if you could look to see what this looks like, it's going to fill in farther, but it's likely not going to spike up to 21% at this point. If anything, it'll go to 18 or 16%.
One of the other things I'm seeing people ask about so much on here right now is the schools, and more Valley school districts are adjusting their plans. If you want to find the very latest information on that, it's at abc15.com/schools. We have a whole area there where you can click on the school of interest to you, maybe your kid's school or your grandkid's school. Many of them now adjusting that in-person learning start date. Several of them have pushed it back to October, so it would correspond to start again after their fall break. We've highlighted a couple here over the past few days, more coming in overnight. Deer Valley School District changing their start date, and also Casa Grande. We understand that Flagstaff is going to be talking about changing their date. That coming up on Thursday. The other person I want to highlight that you should follow on Twitter or here at ABC 15 is Danielle Lerner, and she is our education reporter. So I'm seeing all those comments on opening schools, and that's the best place to find the information on when your particular school district is either talking about or holding a meeting to discuss their plans, or that they've got plans solidified already on when your kids can come back to school. So that's the best place to find it. I'd say we have about a half dozen so far that have adjusted their start date. In fact, I can pull up this list right here. Districts moving their official start date: Tempe Elementary, Chandler Unified, and Queen Creek Unified. Now the districts that are starting on time remotely but delaying through Labor Day: Osborne School District, Paradise Valley Unified, Scottsdale Unified, Washington Elementary School District, and then we've got those delaying until after the first quarter or the fall break. That's Phoenix Elementary District, Phoenix Union High School District, Alhambra District, Roosevelt District, Deer Valley Unified, and Casa Grande Elementary School. So the other three that are saying they're gonna delay indefinitely the in-person, or at least until they deem it safe, is Isaac School District, Mesa Public Schools, and Chandler Unified. So you can find that whole list. I know I went over it pretty quick, but at abc15.com /schools. So that's the very latest place to find it. Get to the RT number. Yes, Michelle, we so need to. That was our glimmer of hope today, Michelle. This is our one good number. Obviously too early to celebrate, but we definitely are tracking that closely. We got in the green today, Garrett. Will we stay there is the question. And how long do we need to keep these restrictions that are in place to make that number stick so that we don't see it jump again? Let's show everybody what it is. We're in the green.
So this is RT.live, which is a estimate of the R0 number for COVID-19. Just to go back over what the R0 number is, the RT is how it looks. What that is if 100 people had COVID-19, the RT number would be basically the number of people that could get the virus from them. So how many people one person can transmit the virus to. As you can see, we always want to see that number under 1, and right here we are now estimated at under 1. We are at a 0.97, which means if 100 people had the virus, they could transmit it to 97 people. Obviously, that means there's still case growth, but it means that we're now sort of on the other end of the curve. And you can see right here, we're in the green, as you said. We are now part of the small sort of grouping of states and the District of Columbia that do have a less than one RT. Now, can that change? Absolutely. It can absolutely change, and it could change basically with tomorrow's report, because these estimates are done based on what these daily reports look like and what the percent of positives are to the percent of tests that are coming in. So this could go back up over 1 if we have a very bad report where we have X amount of cases and Y amount of tests and the percent positive is over 25, 30%, that RT can go back up. So right now, it's a very encouraging number. As we go farther along, it will be more stable, and hopefully it will continue to stay under 1 for the foreseeable future.
Yeah.
And the hope, of course, is that it never goes back over 1.
Yeah, that would be great news. And Garrett, just to stress, this chart would only look then at positive cases. It wouldn't look at outcomes such as deaths or hospitalizations. What it's there to judge is basically who's infected, who's not.
Yes, this is not a forecast or a model in the way we've seen take into account deaths and stuff like that. This is literally just how many people can the virus be transmitted to from one person.
Yeah. Okay. So how many died today? Carolyn asks. Carolyn, look at your adorable little family there. Thanks for joining us on here. The report is that 97 came in over the last 24 hours. That does not mean that they passed away today. So the numbers that we get in the next few days will be matched up with the exact date. So we could see that. So in other words, we could get deaths reported later in the week, and they actually passed on this particular day. It's worth noting when we plug those dates in to a chart that you have created here, Garrett. What is our peak death date in relation to that at this point?
So the actual date of death, the peak date of death in Arizona right now is June 30th at 55 deaths.
Okay, hopefully that helps to answer Carolyn's question. Is that a graph that she can then find online? In addition to, Carolyn, what we're talking about on the Arizona Department of Health site, on the summary page, that's where you are going to see what has been reported to you in the last 24 hours. So you can click on the summary page and see the general number, and Garrett's going down to the more specified chart to see the date.
And I also like to make just a sort of a word of caution with this graph. This graph will always read like deaths are declining dramatically. As we talked about, these numbers are going to be filled in, quite pronounced. So right now we have 8 deaths on July 13th. In about 4 or 5 days, that number is going to be likely somewhere in the 30s. So we just have to just understand when you're looking at this date, it's being filled in over time, as Katie said. So don't look at this and say, oh, look, deaths are declining, because that's an incorrect reading. That same goes with the hospitalization chart, by the way. When you go on the hospitalization chart, do not read that chart and say, oh, look, hospitalizations are declining, because that chart takes about 15 to 20 days to fill in at this point.
And Garrett, so with that, this date can then adjust. So although we're telling you that the date that we mentioned there is the height of this, that of course can change as some of those dates are filled back in. So Carolyn, hopefully that answers your question, so you can make good choices for that sweet little family there. Adorable pictures that we're seeing on some of these. Some of the other questions that are coming in, I want to get to as well. Let's see. What is the RT number? Joan was asking once again. That's basically how fast it's spreading in the community. The R naught number is what how you actually pronounce it.
Yes, it's the R naught. It's how fast it's spreading, and right now it's under 1, which is exactly where we want it. So we want to see how long it lasts. We hope it doesn't go back above 1. Essentially, that's
and Joan, the reason we started stressing that so much on here is because we know it's one of the metrics that the governor watches closely, and because he's making decisions for our community, we wanted to make sure that you know where to find that number, so that you can watch it as well. Loke, I hope I'm pronouncing your name right, saying too many people dying. Absolutely agree. This is what this is all about, is to try to help people understand where they can find the numbers and make the best protection so that we can help to keep these numbers low. What is the child positive percentage for ages 0 to 17? Oh, you guys, so many people are on here and we appreciate it, but the comments are going by so fast. I'm unable to catch who just posted it. Let me scroll back just a bit. Julie Camp writes, What is the child positive percentage for ages 0 to 17? Well, first of all, Julie, the only split that we have is under 20 years old. So we'll pull up that number for you so we know that that doesn't just go up to the number you're looking for, but that's how it's split in demographics on the Arizona Department of Health website. And we're looking at 14,000 cases so far under 20 years old. So 11% of the cases are considered children or almost children in this case because they're under 20. We wish that we had those numbers split out even more, but that's what that's what
so
we get.
It's a simple calculation to get an estimate on the percent positive. You take that 1477 and you divide it against this 8152, 552. So that comes out to about 18% positive rating for the less than 20 at this point.
Of those kids who are getting tests.
Yes.
Yep.
Yes.
Kim is asking, is it true that the majority of cases are in southern Arizona? We can see the case map by community right there, and we can see by zip codes. So I'm thinking either of those places we could show Kim how to find that number as well.
There's a little misconception. The majority of cases are absolutely not in southern Arizona. They are in Maricopa County. Maricopa County is the most populous county in the state, so they will obviously have the most amount of cases. However, with that being said, when you put it to a rate per 100,000 population, you can see that several southern counties have been impacted by COVID-19 harder than some of the other areas of the state. You can see as of right now, still, Santa Cruz, this very small, geographically small county right on the border of Mexico, has the highest rate of COVID-19 per capita in the state. It used to be Navajo County, and then it shifted to Santa Cruz. And you can see, obviously, Yuma County also has a very high rate as well. Maricopa County's rate, it seems to be about where, I mean, it's much higher than Pima. But you know, it's sort of where in the same sort of range as the other counties.
Mm-hmm. Garrett, show us where you adjusted that on the graph there. It was pretty quick, and I know several of these sites will do an adjustment for population so that you can better get a sense of how your community's affected.
I'm going to switch it to dark just so it's easier to see. So it's right here.
Yep. So then you're able to see what it looks like based on just case numbers alone, and then what it looks like for population. I love that more of these sites that we've been going to have that adjustment so that people can sort of compare. It's one of the tools that we used when we were judging Arizona against the entire U.S. So when people were hearing information coming out about the U.S., it sounded so different than what we were going through here in Arizona, and that was helping to sort of tell the difference in our experience here in Arizona with this late bump in numbers that happened in May. Oh, Garrett, you have a fan here. Thank you so much for writing that. Garrett is awesome. We're so lucky to have him here. He's a numbers guy, and it's Garrett's 1-year anniversary with the station. So happy anniversary, Garrett. We sit right next to each other here. We both love numbers. So this has been a perfect fit for us to try to help you work through the numbers. I'm here at the station just for today. Normally I'm working at home, but you can see that is an empty station behind me there. So that's kind of how things are right now. Garrett's at home. I'll be back at home tomorrow. So I'm here at the station today to anchor the 4 o'clock newscast. So let's see. I just saw, Allie writes, where can we see the recovered numbers on a daily basis? Happy to help. I hope I'm pronouncing your name right, Ollie or Allie. We don't have an agreed upon definition yet because this is a new virus for recoveries, but let's show you where you can find hospital discharge numbers, which is the best we have to go on at this point. That's through COVID tracking, or we could do it right here on these. Could we do it on the hospital?
Yeah, she wanted it by day, so that's why.
Oh, by daily basis.
Daily basis. If you want to look at the actual what the number of hospital discharges on a daily basis, you would go to this graph right here. You can see 477 discharges yesterday. Now, again, as we said, the discharge number, this could be any number of things. It could be transferring out of a hospital. It could be a death. That's why this is an estimate and you know, the only one that we have, because what it is the release of a bed. So the release of the bed could be multiple things, not just recovery. And of course, someone could be in a hospital, can go to the hospital more than once. Yeah,
I had a friend who was discharged 3 times for this. John asks a really important question. Garrett, we haven't talked about this yet today. John was asking, John with an H, so that our producer Carrie can pull up his comments as well. First of all, thank you, John. He writes, "You're both great for dedicating yourselves to this effort. We are happy to help you find this information and happy to teach where to find this. How do the data restrictions being put in place impact your stream?" So I think what John's referring to is this sort of request of a sidestep for information to go directly to the White House instead of the CDC. The information that we're getting on most of these sites, Garrett, is coming right from the state. So it's not coming, as I understand it, it's not going to the CDC and then back to Arizona. We're getting our raw numbers from Arizona.
Yes, all this data is coming directly from reporting systems that are used by the CDC. It's not by the CDC, my apologies. All of these are coming from reporting systems that are used by the Department of Health and the hospitals. There are things that are transmit to the CDC, but this data is much more real time, much faster than what the CDC puts out. CDC data always has about a 2-week lag on it, no matter what. And so this does not impact how we're going to be doing our reporting, simply because we don't use any of those sources. We don't need to.
Yeah, John, one of the best ways to illustrate that is sometimes I'll hop on Johns Hopkins and their COVID dashboard that has been so great for so long and was an early trendsetter in all this, helping us get the numbers. And it can be so delayed from Arizona because it's going through 8 different channels before they're mining that data to show us. When we go directly to the source here in Arizona, we're able to get those numbers even faster. So Margaret, thanks for joining us today. Margaret's writing, how many ventilators are in use right now? Luckily, we do have enough ventilators, so that's the good news in all of this. However, we do have many in use. What does the number look like for Margaret?
I'm going to turn it back to dark again so it's easier to see. And here we go. On July 14th, 52% of the ventilators in the state have been used. That comes out to 1,009. We have 945 available at this point. So these are all ventilators, not just COVID-19 specific ventilators. If you want to see that number, that one is right here, right there. And you can see we have about 671 ventilators that are being utilized by COVID-19. This number is not exclusive or mutually exclusive to the last number we just looked at. It is a part of that number. So of those 900 ventilators, 671 of them are being used by COVID-19 patients.
And I think that's kind of what Danielle's asking as well. Is there anywhere to see the available ventilators? And that's that number that you just highlighted, 945 available. So Danielle, hopefully that helps you find that number. This is again through the Arizona Department of Health site.
There is no ventilator reporting for Maricopa County. So we do not have any idea of what these numbers look like on a county by county basis. This is just a statewide total.
Perfect. Let's see. How's the R naught looking? Heather's asking that. Heather, we just touched on it. We are under 1, at least at this point. Garrett, someone was asking a bit ago, some of the different R naught sites were posting a different number. So they're all sort of, their methodology is slightly different in how they track that number. The most reliable one that we found is RT Live. That's the one, or RT.live. That's the one created by the designers of Instagram. I think that's what we had heard.
Yes.
It's just an easy to view site. It's easier to find. And Brian's asking, I missed that info. What does it measure and why is it important? Important for a couple reasons. It's measuring how fast the disease is spreading state by state, but it's also one of the key factors that the governor's watching. And he's obviously making decisions for us. So it's so important, we feel, to pass that number along to you so you can see, like, are we doing it right? Are we headed in the right direction? Can we keep this thing going and get this thing under control? And
of course, you have to understand that, as you said, these are estimates. So whenever there's a statistical estimate, there's always a range involved, no matter what. So the 0.97 is the statistically best guess of what the actual R naught is. However, the range right now is anywhere from a low of 0.75 to a high of 1.15. So when you take into consideration of the range, we would have to be, if we're using the same confidence intervals, we'd have to be under 0.75 to be entirely 100% confident, at least in the statistical formula, that we were under 1. So what we're saying is we're pretty sure we're under 1, but we're not 100% sure. So we have to give an estimated range of anywhere from 0.75 to 1.15.
Yeah, as many of us jog back to our statistics classes, 95% sure Is that correct? That
Yeah, it's usually
95%
95%.
sure.
I'm not sure with this, but that's almost always.
Usually,
It's almost always
usually. If you don't see it marked there, that's basically what it is. We're 95% sure that we are at that number at this point, but that range accounts for any error in what we're finding. So really good questions on all of this. So once again, if you want to look at that site for yourself and dive in a little more, maybe look at your home state if you're not from Arizona. Producer Carrie's put it up on the screen there. It is rt.live, just a really great, easy to digest site that helps you better understand how we look compared to other states, how the US looks, and it's worth bookmarking that page as well. All right. A couple other things that we wanted to update you on. Some people had asked about the gyms and the gyms staying closed. For those of you who joined us yesterday, a judge has ruled against a local fitness company. They were fighting to try to stay open in all of this. And as many of you know, Governor Ducey ordered the gyms to be closed at least through July 27th. And some of the parent companies and some of the gyms around town had been fighting to stay open, and a judge just did not agree with that order. One of them, Exponential Fitness, that's the parent company of places like Club Pilates and Pure Barre. They had filed a lawsuit. They have 50 locations in Arizona. They were fighting to stay open through all of this, and a judge has denied their motion. That came in just late yesterday afternoon. So it sounds like most of those gyms in Arizona will need to stay closed at least through July 27th per the judge's order. So we wanted to keep you updated on that as well. Any other numbers that you were tracking closely overnight that were of interest to you, Garrett, that you saw that you think we should know? We want to try to track all the trends for you, so all of you at home can see when things are changing too. You don't have to spend your whole morning diving through the numbers as Garrett and I do.
Yes, I'll just go quickly over the remaining COVID-19 specific metrics for hospitalization. These are all very important metrics to follow. The inpatient, which is the acute care beds, as you can see from the beginning of the shutdown ending, we were on a tear, if you will, of this number going up aggressively, and now we're starting to see a leveling off ever since about the 7th. We've started to see a leveling off. Now this number, when I told you about the hospitalizations, this does not necessarily follow that. This is a bed count that's done by the hospital systems on a daily basis. So this is a much more accurate, more near real time shot of what's happening on these numbers. So you can see right here a leveling off of that number. We've already seen the ventilator number that is close to a record. And then the ICU, which is a lagging indicator, we hit our record for ICU yesterday. It has gone down today. We're looking to see what's going to happen tomorrow, if it's going to go up or down. We're going to see if this starts to follow sort of a leveling off pattern, or if it starts to continue to go up again. That's going to take about 4 or 5 days to determine. We already talked about the discharges. This really doesn't follow that. The trend is a little more varied on this one. Emergency. This is we had a very good trend going on for this for quite some time. It has gone back up, but that doesn't necessarily break the trend entirely. So we're going to be watching this to see if these numbers continue to drop or if they start going in the other direction. And then intubations. This is people who were actually fitted for a tube to be put on a ventilator. That number's at 108 right now. It's still in this sort of large grouping of these July, late June numbers, but it's not at a peak.
Garrett, so many questions are coming in, and I want to get to all of them. And someone just wrote, Katie, please take my question. I've been asking for 5 days, and I see. Let me get back to your question here. Okay, he's got a few questions coming in. When is the peak coming to Arizona? Well, first of all, Garrett, it does kind of look like we may be in not a peak, but a plateau at this point.
Yes. Let me go to, I'm trying to fire, there it is. Okay. So I'm going to go to my model, my forecast model. So not mine. This is the one I like to use. This is COVID-19-projections.com /US-AZ. This is an MIT model. And as you can see, it also has an R0 estimate that has us at 0.99. And then here we are. This is sort of where it's thinking our peaks are. And it believes that as far as new infections, we are now sort of past the peak. Just yesterday was technically our peak, so we're just past the peak as far as this model is concerned, and we have a little bit more to go on current infected and then it will start to go down. Now these bubbles, obviously, these curves do move forward. It thinks this is where we are. It's its best guess, as we talked about. But if, again, we start reporting something that dramatically changes this movement we've been on for quite some time, then they'll shift the curve again.
We would see that adjust. Hey, Garrett, scroll down on this page if you would. Let's see. Are we at the bottom of that page?
Yeah, this is as low as it gets.
There is a total infected. I was playing around with this chart yesterday because I thought it would be interesting for folks to sort of slide ahead to August 17th. That is the projected in-school, in-person start date. So you could kind of play with this and see where the numbers are. I'm hearing from so many parents, Garrett, who are so frustrated because they have to make a decision now about what their kids are going to do. And here we are in July, and you and I have kindergartners, and so those decisions are being requested, rightfully so these school districts can plan and try to get ready for our kiddos and make things safe for those who want to show up in person. And this then gives you an idea, a forecast, if you will, a projection of how things might look at that time, the number who are currently infected at that time, and the number of total infection rates. So if people want to jump on this website, scroll ahead. How far out can we look at the numbers for them on this page? If you move the bar over, does it take us all the way? Okay, so it takes us right through.
Yeah.
Great.
All epidemiological models go 90 days. That is it's a sort of a law in the epidemiological world. So yeah, if you look at this number on the 17th, you can see, and this is not how many cases we're going to have on the AZDHS site. This is what the model perceives is going to be the true sort of infection rate of cases that are both active and recovered in Arizona. And it believes that around that time we're going to have about anywhere from 2.4 million to about 900,000 people in Arizona will have had the virus.
Yeah, so that's a great chart if you guys want to dive in and you're looking for a forecasted number a ways ahead so that you can make the best decisions for your family. You can find that right there. Beverly's writing, I can't see it. I just hate these charts. Just talk in plain language. Beverly, let me know if there's anything specific you can't see and we can read it. I know on a cell phone this can be really small. One thing I'll suggest is you can go back and peek at it online on a monitor. Or I should mention this, Garrett. Pardon?
I'm trying to zoom it.
I know, yeah. So many people have been when watching this, and we so thank all of you for joining us on here because it means you're finding the information valuable and that we can help you sort out some of these numbers. That they're now broadcasting this on an inside word we use is OTT, but what that basically means is other signals than on television or right here. So you can actually watch this other places on Apple TV and Roku and some of our streaming devices. So look for the ABC 15 symbol there, and you can actually watch this larger on your TV. Or Beverly, go back and replay this once we complete our whole broadcast here, and it'll be online for you. You can watch it on a bigger monitor, or you could look up these specifically and just kind of go to each of these sites separately. It's a little bit easier way to get through it. So sorry if there's one thing we can read or point out, just let me know. I'll watch for your comments and we'll get back to that. So, all right. Any other numbers you want to get to quickly, Garrett? We're already passing the 30-minute mark. Do we have any info? Go ahead.
Oh no, I said I saw someone wanted to go over the what we shared yesterday, the Georgia Tech risk assessment model.
Really great site.
So yeah, we'll go over that really quick. This is a model out of Georgia Tech that says how many people, what is the chance that someone has COVID-19 with an estimated event size. So at 100 people at an event, it presumes that there's a greater than 99% chance essentially that someone at that event will have COVID-19. We can bring that all the way down to 10 here, and we can see that in Maricopa County, it's if you go to an event of 10 people, it assumes that there's a 56% chance that someone at that event has COVID-19.
This tool, it's interesting that you know, we've been looking at this. I've heard from other people, hey, have you seen that tool on Georgia Tech? You guys should talk about that. It's like, we have already been there. It is good stuff. It is a worthwhile thing to look at, and you can kind of slide that by size. I should mention also, Garrett, when we're talking about those size of group gatherings, that the Rose Parade has just been canceled. So that, of course, always comes up in the new year, but it's already been canceled. There is no postponement. That the event has been canceled. No word on the game itself, if it'll still be played to an empty stadium. It's just that the parade itself, the Rose Parade, has been canceled. We'll have even more on that coming up in our evening newscast, but that kind of gives you an idea of that this same risk assessment in that size. Obviously, it draws huge crowds. Dorothy writes, thanks for the information. Oh, she's going to miss us tomorrow, errands day. All right, Dorothy, be safe out there. Be sure to mask up when you're out and about running errands. I know that can feel a little unsettling for people to go do that kind of stuff. Carmen writes, good tool, Georgia Tech. We agree. And Lee writes, thank you as well. So that's why we're on here, just helping you find the information. Anything else we can help you find? Oh, Tara's asking, when is the next news conference? So we just had one from the county, but we have not had one from the governor, and we don't have anything on the schedule at this point. So there's nothing planned from the governor. There was just one from the county, and the information out of that was a lot, because they were ordering. In fact, let me see if I can pull up some of the info on that really quickly. Sorry for the delay here. I'm using multiple screens as I get you updated on this. But basically, in the news conference today, we learned that the medical examiner's office is now in surge capacity for the bodies. So we had seen this surge capacity for the hospitals, and now surge capacity for the medical examiner's office. So they have a 150 body limit in the county office, and their surge space can hold up to 200 bodies. So they've had to order 4 coolers to come into the county here. They're also, Maricopa County is also calling funeral homes to see if they might have extra space at this point. And on Friday, the medical examiner was at 96% capacity. So obviously this surge space and those other 4 coolers that have been ordered were in a pressing need to get that out here. But we'll have even more reporting on that and that update that came from the county a little bit ago. All right, is the zip code map recording the cases according to the patient address or the hospital address, or it depends on if the patient will stay at home or in the hospital? One of the things to note when you're looking at the zip code map is whether you have a hospital or a care facility that is within your zip code there.
So the answer to that question is it will be both. In some cases, there will be, at least initially, the case will be recorded at the hospital if there is a hospital in that zip code. And then if the patient's zip code data differs, it could be transferred to another zip code. But yes, there is some possibility that there will be someone with the zip, that if there's a hospital in that zip code, that zip code may have a higher number of cases simply by virtue of having a hospital in it.
So to get to that site, it is now, as we've talked about and discovered yesterday, Garrett, it is now right there on the Arizona Department of Health site. It wasn't before. So some of you are used to going to this page and then clicking through to a separate link that I thought looked kind of shady and kind of scary. And I always alerted people, nope, that is the right link to go to. They have streamlined that, cut that out. So it is right there on the page, and you're able to stay within the page to look at your zip code. Natalie writes, can you confirm that Arizona is projected to have 2 million infected by November? So that would be on the MIT page that we were looking at before, and
which I just closed.
What was it? Which you just closed?
Which I just closed the tab.
Always, Natalie, we're happy to help you find it. Look at more cute little faces on these profiles. I'm loving these little faces on here. My 3 are at home. Garrett's is playing behind him there. So, yep, we love seeing those little smiling faces. But let's get you that number, because as we were saying, it can move 90 days out, and we're able to slide that bar over so you can make the best choices for your little one there to see how things look.
Exactly. By November 1st, this model thinks that there will be anywhere from 3.5 million to 1.1 million Arizonans infected, or have in total been infected with the virus. Their best guess is that's 1.9 by November 1st. And again, this has nothing to do with the number of cases that are on the AZDH dashboard. This includes the number of cases that are just in community spread that they're simply not going to test for because people aren't going to get tested for it. There's just that this model is presuming that as well.
So these would be usually the mildest of cases then, if you weren't going in to get checked and you were just staying at home and you thought you had a cold or you couldn't get to a testing facility, that would be sort of that range. Can you share your screen? Oh, thank you, Sherry.
Oh, yes, of course I can.
Let's thank you, Sherry. We really appreciate that. Let's share the screen for Natalie so she can see where to find that. So Natalie, those days would be added in as we get closer to it. I was digging around this particular site last night and just found these particular projections very helpful when making decisions about school. So you could slide that all the way out to October, to after fall break, to however that looks for your decision making for your family. So that's the COVID-19. Is that the one, Garrett?
That one, COVID-19-projections.com. Yes.
And Natalie, I should mention, I don't know if you're from Arizona, but you can also check other states on there as well. So you can kind of get a good peek. It's not just Arizona centric. Christoph saying no Black Friday. Yeah, it looks like Black Friday's been canceled this year. A lot of even the Amazon date that usually happens, the big push to sell everything on Amazon was canceled this year. It usually comes in July. Let's see. Ariana's asking, what about the increase in deaths in the past couple of days? We have seen so many. I was just mentioning as we started, I had logged onto Facebook briefly and saw another one of my friends on Facebook had just lost his wife. So our condolences to all of you on here who are experiencing something like this, a loved one dealing with this. It's just so hard. So that we have seen some pretty high numbers the last couple days. Today was 97 lives lost reported overnight. Again, this doesn't mean in the last 24 hours. It's just the reporting coming in. And yesterday was high too, Garrett. What was yesterday? Was yesterday 92, I believe?
It was.
It was in the 90s.
I'm pulling up the number right here. Oh, hold on a second. Let me get this correct here. Where did it go? I lost it.
That's okay. We'll let you pull it up. Mimi's writing, you guys are awesome. Mimi, thank you. As she writes, thanks for answering our concerns. We are happy to help you find this stuff. So as the questions come in, we'll direct you to the right place to find the right numbers to make the best choices. You know your family better than anybody. You know what you need to choose to do to protect your family. We're just happy to help you find where these numbers are so that you can make the best choices. All right, Garrett, looks like you got the epi curve pulled up for deaths.
Yeah, this is the epi curve for deaths. The light blue color is deaths that were added today. You can see that even with the 97 that were added, there were some that went back. There was even one that went back all the way to April. So there were some that were done by certificate matching, but the majority of them came from about here on, which is about 10 days. That's about 10 to 12 days. So most of them were added from the last week or so, but there was a percentage that were added, after that. So, or prior to that, pardon me.
I'm getting a couple questions about the ECMO machines. Do we have numbers on ECMO machines here in Arizona? Do we have that data?
I have not seen anything on ECMO machines.
Yeah, I haven't either. I haven't seen that. We'll keep an eye out for that and keep you updated on here if we see those numbers come out. Let's see.
I have a fun thing that I can share. I put this chart together. It's not quite ready, obviously. You're going to look at it and say, wow, this is not a done chart. What it is I took the mobility data from something called Descartes Labs. And what that is it's basically takes a bunch of anonymized cell phone data and looks at an index on the mobility. So what you have here is this is pre-shutdown, and you can see it drop dramatically during the shutdown. This is during the opening of the shutdown when things started to pick up again. We hit our peak sort of in late June as far as getting back to mobility. And we were obviously having some pretty significant case rises at that time. And as you can see, since that peak, we've started another decline right now. So right now, Arizonans are deciding to stay home. They're going back into a sort of a stay-at-home mentality a little bit more than they did when we were opening up.
I find this fascinating. I think it's hilarious that you put the caveat in there. It does look like my Etch-a-Sketch drawing. It's very similar, but
I will make this I just did this, so I'm going to make this much prettier. But right now, this is just this is a basic chart.
Well, we still appreciate it. We can still get the gist of it, so we appreciate that. Hey, Ray was just asking about schools. Ray, I want to. People are commenting on your chart. I love it. Ray's asking, when is school starting? Okay, so the start dates have been pushed back for in-person across the state to August 17th. But Ray, any particular school district that you're looking for, we've got a whole list because there are so many here. We've compiled them, and you can. It's an easy to use map on abc15.com/schools. So it's got an update on all the changes that are being made. Last week, we saw a lot of schools start to push back their in-person start date to after fall break. For those of you without having kids in school, not having kids in school, it's in mid-October. So they're just saying, let's just start after that date and plan accordingly. So if you want to check your particular school district, some changes just coming in from Deer Valley School District in Casa Grande, you can find that on the site that producer Carrie has just added there, abc15.com/schools. Hey, you're getting some compliments on your chart too, Garrett. So it's, it's not all bad news. Thanks for the homemade chart. Anastasia, his daughter, drew it. I kid. It's good information though to help us understand. All right. Any other things that we can answer? We do have that big push for testing coming up. I mentioned that at the top. Basically, they're hoping to test 60,000 people over the next 12 days. The free drive-through testing. It's going to be held at 2 locations. So. We'll get you the info as soon as they release it on how you can get signed up for that. I wonder if we still have the web address that we could punch up for Emory Women's Health, and there's 24/7. Oh, look at producer Carrie, so good. EmoryWomen'sHealth.com/testing or /testing-blitz. You can go on that. That's a 24/7 site. It's right there at some bus stop drop-offs. They've got walk up, they've got drive up, but you do have to register ahead of time. So jump on that site and then you'll be able to get signed up and they'll tell you what you need before you head over there. But that sounds like a great place to go because it sounds like there would be less of a wait if you scheduled in some off hours and you didn't have to wait too long out there. Anastasia's writing, can we have an improved chart by Friday? This is great. You guys are great.
Yes.
We love it. We love the Razin. All right. Any other numbers that we can get to? We have gone so long and it's 3:15. I got to get ready for this newscast at 4 o'clock. I've switched shifts with Faye again on a Wednesday, and you can see all the people behind me here. It's an empty newsroom. So Mimi's asking about the saliva test through ASU. Is where there's going to have another day. I just saw somebody's comment pop up, Carrie, and I didn't get to read it. If producer Carrie can pop that back up. Thank you, Monica. You're so welcome. Absolutely, be safe and mask up. That is the best advice. I think we can end right on that today, and we'll have even more for tomorrow. So, Monica, thank you for saying so. We appreciate it. And thank you for all your questions. You guys, the questions have been coming in so fast. If we can scan through them and get to any others, we'll answer them tomorrow. But Garrett, you'll be back here with me tomorrow?
Yep.
All right. We'll dive through the numbers for you, help you all understand them as best we can. And don't forget, as always, our newscast coming up. I'll be there at 4 o'clock if you want to join me for that, or our newscast at 5, 6, and 10 p.m. And as always, more information right there on the bottom of your screen at abc15.com/coronavirus.